Hello, my name's Emma Pfeiffer, and today I'm going to tell you about the disease of sudden infant death syndrome, also known as SIDS. So, what is SIDS? According to the National Institution of Health, sudden infant death syndrome is the term used to describe the sudden death of a baby younger than 1 year of age that doesn't have a known cause even after a full investigation. Even though the causes of SIDS are unknown, there are some clues that have helped researchers to try and reach conclusions. Researchers have found that babies who died from SIDS had higher levels of serotonin in their blood. Out of balance levels of serotonin could affect how the baby's body handles regular functions or everyday processes like waking from sleep and breathing. So, what causes SIDS? There is no direct known cause of SIDS, yet there is an informed theory attached to the disease. The name of this theory is the triple risk model, which was proposed in 1994 by Filiano and Kinney. They contended that SIDS was more likely to occur if the newborn experienced a critical development period, was exposed to stressors, and was inherently vulnerable. And now I'm going to go into more detail on each of these three risk factors associated with SIDS. The first is the critical development period. So the majority of SIDS death occurs within the first 6 months of birth. In fact, 90% of cases happen within these first 6 months. This is the time frame when the infant brain is undergoing extensive physiological changes. There's chances of inflammation and pro-inflammatory cytokines, chances of abnormalities in neurotransmitters, and additional stressors such as hypoxia. The second risk factor is exogenous stressors. These stressors include prone sleeping position, which is sleeping on one's stomach. This is the unhealthiest position to sleep in. While it does help with snoring, it is not advised by medical professionals. The second is overheating with excessive bedding. The third is co-sleeping, which is sleeping with a parent instead of the baby or infant sleeping in a crib. And the fourth is other environmental threats. These exogenous factors are challenges that a normal infant would be able to overcome and survive, but an already vulnerable infant may not be able to. Then the third and final risk factor is a vulnerable infant. So the first thing that can make a infant more vulnerable is being male. In fact, the ratio of male to female infants who will have SIDS is 60 to 40, but it is not clear why this is true. The second is prematurity or low birth weight. Then the third is genetic polymorphism, and some infants may carry unidentified genetic mutations or polymorphisms that interact with environmental factors in complex ways that increases their likelihood of getting SIDS. Then the fourth thing that can make an infant more vulnerable to SIDS is prenatal exposure to drugs and alcohol. Maternal cigarette smoking increases the risk for SIDS by 5-fold. The prevalence of maternal smoking in SIDS mothers has increased from 50% to 80% in recent years. It is hypothesized that nicotine is able to cross the placenta into the fetal circulation and is then able to make its way into the receptors present into the fetal brain. There are some additional factors besides the triple risk model. The first is geographic location and climate. SIDS is more common in colder climates than warmer climates, and it is more common during the winter months than in warmer times of the year. The second is ethnicity. The chance of SIDS is lower for those of Asian heritage and higher in the African American heritage and indigenous populations. Then we have parental characteristics, such as I've already talked about, with smoking and drinking. And then another factor is sibling deaths. And there have been reports of an increase in the incidence of SIDS between 2 and 10 times in an infant who has had a sibling death, including an increased risk based on the presence of SIDS in second and third degree relatives. And the final is sleep patterns. And there is some evidence that suggests that infants dying of SIDS have altered sleep patterns and altered responses to stressors while asleep. So now that we know what it is, how can we solve SIDS? Based on research conducted, encouraging pacifier use in infants is likely to be beneficial on a population-wide basis. And based on the U.S. SID rates, one SIDS death could be prevented for every 2,733 infants who use a pacifier when being put down to sleep. These researchers recommended pacifier use for infants up to 1 year of age, which includes the peak ages for SIDS risk and the period in which the infant's need for sucking on something is at its highest. For breastfed infants, pacifiers should be introduced after breastfeeding has been well established. Then a different research study contended that sudden infant death syndrome risk reduction curriculum using a train-the-trainer model is effective in improving the knowledge and practices of child care providers. Education of parents, expanded training efforts, and statewide regulation mandates and monitoring are critical to ongoing efforts to decrease further the risk of sudden infant death syndrome in childcare. And I have a video that I will show.
Off the top at 6, it may provide answers to the thousands of parents who have lost a child to sudden infant death syndrome, or SIDS.
Researchers in Australia have found a link to the way the brain sends messages to the rest of the body and SIDS in certain infants. News 8's Joe LaFurci is here with the local doctor's take on this discovery, Joe.
Brian, Sue, sudden infant death syndrome, or SIDS, is the unexplained death, usually during sleep, of a seemingly healthy baby less than a year old. Its cause has long been a mystery to the medical community. The study is in next month's edition of the eBiomedicine online biomedical journal. May help end that mystery. The loss of a child brings unimaginable heartbreak.
But not understanding what has happened adds a layer of grief and confusion and guilt and sadness and sorrow to the family.
Spectrum Health pediatric specialist Dr. Kira Sipling has had to break the news to parents who've lost a child to SIDS.
And then there's remaining questions about the risk for future children and the complexities that go with that.
But a new study suggests there may be some answers as to why a child suddenly dies with no obvious explanation. June's issue of the biomedical journal eBiomedicine reports Australian researchers studied neurotransmitters, the signal the brain sends to the body to make sure hearts, lungs, and other vital organs are operating.
If you get too much of one or too little of a signal, you'll have problems.
The study looked at an enzyme that regulates the neurotransmitters.
It turns out in this study, this small study, that the infants who succumbed to sudden unexplained infant death had lower levels of this neurotransmitter breakdown enzyme at day 2 of life.
Of the 3,400 sudden unexpected infant deaths recorded by the CDC in 2019, 37% were attributed to SIDS. 34.7% were of unknown causes, and 28% were the result of accidental strangulations in bed. According to the Michigan Department of Community Health, of the 137 unexpected infant deaths in 2020 in the state, 43 died as a result of SIDS. Simple suggestions like laying babies on their backs to sleep and limiting the amount of bedding around them has decreased SIDS cases by 50% since 1992. The big question for parents, does the study suggest a cure or an early warning?
I think it's much too soon to know that because this was just one possible finding.
And we have a link to the study as well as other information on SIDS at woodtv.com.
Off the top at 6,
Okay,
it may provide
sorry. And there are my references. Thank you for listening to my presentation.